Welcome to This Explainer. Today, we're tackling a topic that affects millions of guys out there, but honestly, it's so heavily misunderstood. We're going to completely reframe how we look at erectile dysfunction, because we really need to stop seeing it as just this embarrassing bedroom issue. Instead, we need to recognize it for what it actually is, a crucial, literal, life-saving early warning sign for your overall cardiovascular health. So, let's just jump right in.
Look, I know, it's a super vulnerable question, but it's an incredibly important one to ask yourself. If you haven't woken up with a strong, natural morning erection in weeks, or, maybe even months, well, your body is actively trying to send you a critical signal. And no, it is not just about getting older. It's actually a glaring alarm bell telling you about depleted magnesium levels, a nervous system that's just totally stuck in overdrive, and most importantly, a failing vascular system. So here's what we're covering today. First, the ultimate heart warning. Then, the actual anatomy of an erection. We'll clear up some masturbation myths and anxiety, look at essential clinical tests you need, explore natural nitric oxide boosters, and wrap up with your 7-day schedule to get things back on track.
All right, part 1, the ultimate heart warning. We're talking about catching the quiet signs of cardiovascular disease.
Let's start with a critical truth that's kind of hiding in plain sight. For men over 40, ED is rarely just psychological or hormonal. In the vast majority of cases, it's actually a plumbing issue, a blood flow problem. And it is the absolute earliest visible sign of progressive cardiovascular disease. Just think about the sheer math of your anatomy for a second. Your penile arteries are tiny, right? Only about 1 to 2 millimeters wide. But your coronary arteries, the ones feeding your heart, are much larger, sitting around 3 to 4 millimeters. Because those penile arteries are so incredibly small, a tiny half-millimeter fatty plaque will cause a massive 50% blockage down below. But that exact same plaque up in your heart, it barely restricts blood flow at all, meaning you won't feel a thing in your chest.
Because of this anatomical reality, erectile dysfunction will typically show up 3 to 5 years before you ever experience angina, a stroke, or a heart attack. Let that sink in. 3 to 5 years. Your body is literally giving you this amazing early alarm system. And the best part? It's something you can actively reverse through lifestyle changes, way before you ever end up in an emergency room.
Moving on to part 2, anatomy of an erection. Because it's really a vascular event, not just a muscular one.
Okay, to actually fix this issue, we've got to demystify the actual mechanics of an erection. It's not a muscular event at all. Ultimately, it's just a plumbing event, completely driven by healthy blood vessels and signals from your nervous system. And the absolute star of this plumbing show is nitric oxide. See, when you're aroused, your nervous system releases nitric oxide to tell your blood vessels to relax, open up, and dilate so blood can rush in. This mechanism is so vital and honestly so powerful that emergency medicine doctors actually use nitrate sprays to instantly boost nitric oxide to save patients' lives during active heart attacks. That's how crucial this molecule is.
But here's where the plumbing can go wrong. If your arteries are stiff from things like high blood pressure, diabetes, or just a generally poor lifestyle, you might run into something called venous leakage. It's kind of like trying to fill up a water tank while a drain tap at the very bottom is still wide open. If those smooth muscles fail to clamp your veins completely shut, the blood just drains away prematurely, either before or right during the act.
Next up is Section 3, masturbation myths and anxiety. Time to separate biological facts from psychological fears.
Now, before you go assuming your physical plumbing is completely broken, we absolutely have to address the intense performance anxiety and, frankly, the wild societal misinformation surrounding men's health. So, clinically speaking, let's clear the air right now. Normal masturbation does not cause permanent physical nerve damage. Your body is not some battery that just runs out of sperm or energy. Instead, the real culprits behind psychological ED are things like intense performance anxiety or maybe temporary numbness from overly aggressive habits, sometimes called the death grip. There's also porn-induced dopamine desensitization, where real life simply doesn't match the extreme stimulation on a screen. Oh, and if you're finding you need a bit more recovery time between sessions, don't panic. That is just a totally natural increase in your refractory period as you get older, not some hidden disease.
Plus, there's another huge piece to this puzzle. To even achieve an erection, your body has to be in the parasympathetic state. That's your rest and digest mode. And guess what? That state is completely, 100% blocked by adrenaline. So if you're stressed out from work, anxious about performing, or feeling guilty, your body flips right into fight or flight mode. Adrenaline floods your system and literally constricts your blood vessels, which makes an erection biologically impossible. It's just science. Okay, part 4, essential clinical tests. How we move beyond symptom-masking pharmacy pills.
So rather than just reaching for a quick temporary fix like Viagra, which, by the way, only temporarily stops nitric oxide breakdown without fixing the actual root cause, not to mention the side effects, we need to treat this as a massive screening opportunity. You really want to sit down with your doctor and ask for the right diagnostic toolkit. For sure, request a fasting insulin test. This is a big one because it catches metabolic issues 15 to 20 years before you ever hit pre-diabetes. You'll also want an HbA1c test, a full lipid profile, and make sure they measure your waist circumference to track that dangerous visceral fat. And if it's needed, a penile Doppler ultrasound can physically visualize any arterial plaquing or fibrosis down there. This is exactly how you catch the disease right at the root.
Which brings us to Section 5, Natural Nitric Oxide Boosters. We're talking about rebuilding your vascular health from the inside out. Once you have your diagnostics in hand, here is the absolute best news. This is reversible. You can actually start reversing the damage naturally using protocols that significantly boost your body's own innate nitric oxide production. For starters, you can radically improve your vascular health just through your diet. Things like beet juice powder and arugula, which actually packs the highest nitrates, by the way, are amazing. Throw in some dark chocolate, at least 85% cacao, pomegranate, and L-citrulline. L-citrulline is great because it naturally spikes your nitric oxide for 3 to 5 hours. Then, on the physical side, high-intensity interval or resistance training directly improves your endothelial function. And hey, if you really want to level up, intermittent hypoxia training, which uses a mask to temporarily restrict air, actually forces your body to build entirely new capillary networks. How cool is that?
But hey, remember our talk earlier about the nervous system being stuck in overdrive? Well, your nitric oxide and testosterone levels are completely dependent on your nighttime recovery. And to optimize that, you really need daily supplementation of magnesium glycinate or L-thronate. A quick pro tip, never buy the cheap magnesium oxide. It doesn't absorb well and just causes digestive issues. You want to take that high-quality magnesium and pair it with zinc and vitamin B6. This specific combo literally forces your nervous system to relax and dilates those all-important blood vessels.
Now, to make absolutely sure that magnesium works its magic, clinical experts like Dr. Amara Cruz highly recommend a strict evening protocol to trigger deep sleep recovery. It's super simple. At 9 p.m., dim all your overhead lights. Then, by 9:30 p.m., turn off all screens and phones to stop that blue light from completely ruining your natural melatonin production. Finally, at 10 p.m., take your magnesium with some warm water. This whole routine is designed to drop you straight into that restorative deep sleep, which is exactly where your testosterone is actually made.
All right, final section, number 6, your 7-day schedule. This is your concrete action plan for long-term recovery.
So, let's consolidate all of these biological, psychological, and clinical insights into a concrete, supportive master plan that you can honestly start using today. Every single day, focus on low-carb nutrition and try to completely cut out those inflammatory seed oils. Also daily, take a 30-minute brisk walk while practicing slow nasal breathing. That breathing instantly pulls you out of stress mode and right into that crucial parasympathetic rest state. On days 2, 4, and 6, hit the gym for some resistance training to boost that testosterone. Every night, don't forget your magnesium, zinc, and B6 stack. And crucially, make sure to perform daily 10-second Kegel holds to strengthen your pelvic floor. Remember, those muscles are the natural clamps that stop that venous leakage drain tap we talked about earlier.
As you start implementing this protocol, I really want you to keep this thought in mind. This isn't about chasing youth. It's about reclaiming what's rightfully yours: vitality, dignity, and the ability to show up fully. Because that's the truth. Restoring your erectile function and your cardiovascular health is really about taking back your vitality and your dignity in all aspects of your life.
You are now fully equipped with the knowledge to see right past the myths, move beyond those symptom-masking pharmacy pills, and actually recognize the early warning signs your body is desperately trying to give you. The math of your arteries absolutely does not lie. But the good news is your future is entirely in your hands. So I'll leave you with this final thought. What step will you take today to protect your heart, rebuild those blood vessels, and truly restore your vitality? Thanks so much for joining me on this explainer, and I will see you on the next one.